The three most common questions we get asked for patients who have lost all their teeth or teeth in one arch basically is, how can the implants help? Are they painful? And how long it will take to finish the treatment? So we have options that we can provide these patients with. It goes from the least involved option, which is placing as little as or 2 implants that will help fasten the denture, the full removable denture to the patients in their mouths. Or we can increase the amount of implants and give them the same denture but with far more retention. Or when it comes to the upper jaw, that denture will have no plastic in their palate, which is something that a lot of people love. Or we can go further up and do the same amount of implants and give them something called a hybrid appliance, which is a fixed or screw retained type of a denture. And we can go up to replacing the teeth individually with implants or with short bridges, small bridges, like 3 teeth at a time. So we have several options that we can provide the patients with when it comes to full arch. We know for a fact that once we lose the teeth, the bone that used to house those teeth degenerates slowly on the top and on the bottom. In fact, the most common complaint we get from patients who have been wearing dentures for so many years, that my dentures don't fit anymore. And it's not because the dentures have changed, it's because the bone has resorbed so much that the dentures don't fit over it. They can keep changing those dentures up to a point where there's no bone left to retain those dentures, or we can help them out by implementing some implant treatments for them and help either stabilize those dentures or basically give them fixed teeth built over those implants. One of the side effects that you see, yes, with patients who have been wearing dentures for so many years and they've lost their facial height, is that their cheek will sink in, and you'll see that even their bottom jaw is closing in further. So even their facial height is diminishing, and that actually their most closest relatives will attest to that, and they'll tell them something's happening here. You see that the lips are sinking as well on the sides. You see some grazing on the sides. So the dental implants will help rebuild that facial height and give them something far more sturdy and stable to function with.